Apologies for the slightly confronting title, but if you are here, you either know you're slow, or people around you think that you're slow and they have kind of shared this video with you. Or maybe you're just here because you're curious and you're interested in workflow and productivity, just like myself, and you want to find out how to do things faster. Here are a few things that you can do to start consulting faster. Number one is to start typing. And what I mean by that is your patient sits down and you do your usual greeting. So in my case, it's, "Hi, I'm Dr. Mike. I'm one of the GPs. How can we help you today?" And they're like, "Well, you know what, doc? I have this abdo pain." And then you always follow up with the second question. "Can you tell me a little bit more about that?" And then you give them what I like to call a golden minute. And this is a really common and useful consultation technique where you basically just shut up for a minute and you just let the patient talk and you encourage them. And then what I generally do is in this golden minute, I type as they're talking. Because effectively, at the end of that golden minute, you not only want to know the history, but you want it to be typed up as well. If you are one of those doctors that types up their consultations once the patient leaves, do not watch the rest of this video. You just need to really stop doing that. That is literally the worst way to manage your time. Because not only will you forget things, not only will you make mistakes, but you'll have to stay late after your surgery. You will eventually burn out. That is completely not sustainable. And so if you want just one tip that will literally change your life, make sure that once the patient leaves the room, the consultation is over. You save and close and you move on to the next patient without anything lingering. Now, I cannot stress this enough. And I know what you're thinking because I was thinking the exact same thing. I do not want to spend the whole consultation looking at a screen and typing up notes. I want to interact with my patient. I want to build up a relationship with that person. And the honest answer is, so do I. And I also want to finish on time. So the answer to that is tip number 2, learn how to touch type. Now, if you think you are too old to learn how to touch type, I also thought that I was too old. And I learned how to touch type at the tender age of 38. So that was a few years ago. And effectively what I would do every single day before I started my clinic, I would spend 10 minutes learning how to touch type. And if you are interested in the process of learning how to touch type, I have created a video about my whole journey and I'll include the link in the description below. But effectively, if you know how to touch type, you can type without looking at the keyboard. That is the key principle of touch typing. As I'm typing, I don't really have to look at the screen. I can maintain eye contact with that patient and document their history. Number 3 is I want you to ask questions that will actually change management. Now, you may or not know this, but I teach medical students, and I actually spent 2 years working at the University of Liverpool teaching undergrad medical students, and these were primarily second and third year students. What I'm going to say now is just my personal opinion, but I feel that we were teaching them to ask about things in the history that don't actually really change management. Now, that's really important when you're just starting out. Make sure you're super thorough and you ask as many questions as you can, first to establish an rapport, to get a really good history, and then from that to be able to make a proper differential diagnosis. Again, as we get older as GPs, I feel like the history is really important, but I only really need to know a few crucial things from that history. And sometimes, to be honest, I see a kid sit down and I know they have tonsillitis before they even open their mouth. You just get a certain feel for it. So what I'm saying here is I want you to start thinking about the questions that will really make a difference to your management. And a great example is that if someone sits down and they have a skin lesion that has been rapidly growing, it's black, blue, and brown over 1 centimeter, I don't need to ask any additional questions. It's a melanoma, and that needs to come out. I don't need to know about their history of previous chemical burns or thermal burns or whether they use sunbeds or not. That really doesn't matter in this consultation that we're talking about right now, because based on the history, looking at the lesion, that just needs to come out, and it doesn't matter what their risk factors are. And I can see the hair standing on the back of your neck because realistically, when we're talking about consulting fast, this is something that we should be able to switch on and switch off. And so if I want to spend a little bit more time with the patient, if we're doing a skin check, I will ask about those things because that will let me risk stratify the patient. But again, if we're pressed for time and they have something that they need to deal with right now, then there are only really a few questions that I need to ask to know what needs to happen next. Now, the fourth way to really speed things up is to really know your guidelines. Now, I personally absolutely love guidelines because I find that guidelines are the easiest way to provide the best patient care and to also speed things up. So when we're talking about guidelines, I don't necessarily mean to know all the guidelines by heart because that is pretty unrealistic, but to at least know where to find your guidelines or to have them up every time you start seeing a patient. I've created a video that explains how to create a button that will automatically preload all of your Internet Explorer or Google Chrome tabs with all of your guideline pages. So that if patients come in and they have perioral dermatitis, for instance, then you have the guidelines open, you just pop in perioral dermatitis, and then you can quickly check the guidelines. And the turning point in my career when I realized how important guidelines are in terms of speeding things up is when we were practicing for our GP exams, our final exams. And part of that is you have a 15 patient OSCE, but you only have 8 minutes per patient. And so for most GPs, 8 minutes is absolutely terrifying to take a history, do an examination, and come up with a management plan. And so when we were practicing, I very quickly realized that the GP registrars that were really running over time or weren't getting full marks were the GP registrars that didn't really know the guidelines. As GPs, even if we don't know the guidelines or there aren't any guidelines for the condition that the patient is presenting with, we do have our own secret ways to make consultations work, which I'm not going to talk about here. Well, yeah, actually will. They boil down to ideas, concerns, and expectations. But realistically, if you know your guidelines well, you will be able to consult fast. And I don't just mean guidelines in terms of management, but also referral pathways. Tip number 5 is do all of your referrals in front of your patient. Now, I honestly hope that I'm preaching to the converted, but effectively, if you are one of those doctors that has a long list of things that they need to do at the end of their clinic, we really need to work on that because that is just simply not sustainable. What I always do is by the end of the consultation, if a patient needs a referral, I will literally type it up in front of them and I will often print it out and give it to them. Or if it is an electronic referral, I will just send it in front of them and turn the screen and show them that it has been sent. I have never had patients complain that they had to wait for me to do the referral or ask me to do it in my own personal admin time. And I think the problem here is that you might think that your referrals need to be more detailed than they actually need to be. And the way we realized this is we had a bit of a study group once we qualified as GPs. And this was actually a cool study group that was organized by the Royal College when I was in the UK. And a whole session was about referrals. What they effectively asked us to do was to bring in the last 5 referrals that we did just to compare how we structure referrals. And it became very apparent that there were GPs there that were writing essays as referrals, really, really long referrals that must have taken them at least 10 to 15 minutes to write. 10 to 15 minutes, that's how much time we have with the patient, right? We started talking about whether it actually makes a difference for the specialist if we write a really long referral or if we write a really short referral. And one of the key insights from that session was that a few of the GPs there had partners who were specialists. And we basically asked those partners, listen, what do you do with the GP referral? And half of those specialists actually didn't even read the referral. Because medical legally, they need to take their own history, do their own examination, and decide on the appropriate management. So as GPs, we are referring not for specialists to do a certain thing for us. We are referring to a specialist for them to make their own assessment to help us out. Obviously, we can make some suggestions. I feel that sometimes we are potentially putting a little bit too much emphasis on how detailed our referrals need to be. Again, if you really want to make really long referrals, that is absolutely fine. That is completely up to you. But I'm just worried that this will come at the cost of you always running late, staying late after work, and then effectively burning out. Number 6 is take essential breaks. Toilet, tick. Lunch, tick. Chatting with nursing staff, tick. Staring into space, also tick. Having a breather after a difficult patient, also tick. And the whole idea behind all of these tips is that you can have those essential breaks because self-care as a medical practitioner is really, really important. And to be honest, I have experimented a bit with not having toilet breaks. So say I was running really late and then like, oh man, I really need to go to the toilet, but this patient has been already waiting 10, 15 minutes. Let's just bring them in. It'll probably be a quickie. It is literally never a quickie. And so I personally feel that patients get a better consultation with me if I have done my business toilet wise than if I'm just sat there and kind of waiting for them to leave because I really need to go to the toilet. And another thing is with lunch. I mean, we have all experienced being hangry, where you're basically hungry and you're getting a little bit irritated and a little bit annoyed. And so you will not provide good patient care if you are really, really hungry. And so a lot of research has gone into patient satisfaction, but actually turned out that patients prefer to wait a little bit longer for their doctor, but to have a meaningful and not rushed consultation than wait shorter, but to have a rushed consultation. And so realistically, even if your patient is waiting 15 minutes, just take 10 minutes, sit down, have a sandwich, and then spend a little bit more time with that patient. And if you're running really, really late, let your receptionist know to let your patients know. Because if patients know that, listen, I'm sorry, this doctor is running half an hour late, he had a difficult case or whatnot, then patients are more understanding of that, and you will effectively have a better consultation and you will provide better care. So realistically, even if you're running late, take a toilet break. Even if you're running late, make sure to eat something, even quickly. And even if you're running late, we'll have a chat with the nursing staff. So again, this comes from my own personal experience of trying to do things differently, like just blitzing through patients and not having lunch. And those last consultations are never satisfying, either for me or for the patient. And I know that deep down in your heart, you also know that this is true. So you must eat lunch and you must have your toilet breaks. Now, last but not least is number 7, use IT shortcuts. I touch on a lot of IT shortcuts in my YouTube channel because I'm interested in IT, I like productivity, productivity. I like doing things faster and better. And it's kind of funny how most clinicians don't see themselves as professionals working with computers, because they're like, I don't work with computers, I work with patients. I mean, I know that's true, but realistically, everything is on your computer. All of your patient notes, all of your patient results, all of the referrals, everything is there. And so the better you are at using your computer, the faster you will actually be at consulting with your patients. And so a lot of clinical systems will have a lot of shortcuts. Like in EMIS in the UK, we had quick codes and text. And in best practice, you have autofills. So these are little shortcuts that will pre-fill information for you. And I'll go into a lot more detail in another video. But realistically, there are not only shortcuts within the clinical systems that you're using. There are also general Windows shortcuts, keyboard shortcuts. If you know how to use them well, then you will be faster. If keyboard shortcuts are completely foreign to you, the shortcut that I want you to use right now is Alt-Tab. And try pressing it. And effectively what this does is it lets you swap between the windows that you have open. This is crucial. And when I showed it to the nurses, they were like, oh my God, how did you do that? Because often we will have a few windows open that we want to switch to very quickly. And most people will just use their mouse, and using your mouse is the slowest way to use a computer. By the way, if you didn't know that, and they will click to one window, they will click to another window. But with Alt-Tab, you can do that with a keystroke. Now, I did forget to mention one more tip, and this one is a little bit cheeky. Just come back, because this is what we do on this YouTube channel. We talk about ways to make things faster and more productive and healthier for you as a doctor, as a clinician, and as a human being. And if you do have any other tips that you would like to share in terms of consulting faster, feel free to leave a comment below. Otherwise, good luck.